All right, so we are 4 minutes in, and I'm going to go ahead and get started. And on this challenge, we've been talking about infertility, and we started out on the first day talking about the top causes of infertility, hormone imbalance, low-grade inflammation, autoimmunity, and scar formation. And the problem is actually men and women experience infertility, and some things that both have in common are autoimmunity, inflammatory conditions, hormone imbalance, and insulin resistance. And we also threw in there some studies that I found about talking about the microbiome. And they talk about the microbiome in both men and women. So I'm just going to remind you of the diagram or the graphic that I provided on the first day that I based my practice on. And in the center of that graphic is the mental, emotional, spiritual. And we're talking about the biological systems that interact in the body that cause illness. And the other that are important are nutrition, detoxification, fitness or movement, hormones, sleep or stress, or the nervous system. And well, let me go back. So on the first day, we also mentioned that PCOS is one of the top causes of hormone imbalance in women, causing infertility. And we talked about some of the symptoms that people get with PCOS, like acne, like missing their menstrual periods, like hirsutism, which is growing hairs like in the chin due to the androgens or the male hormones being out of balance, people losing hair, and women also having a lot of weight loss resistance due to the insulin resistance. So on this slide is something I talked about yesterday, as far as the microbiome having a lot to do with the insulin resistance that's found in the ovaries that's contributing to PCOS. And they also mentioned that this dysbiosis can cause disruption of the bile acid biosynthesis going on in the liver. And I also mentioned how there's a high incidence in people that have insulin resistance of problems with the gallbladder or having gallbladder removal. And we also know, even if you just watch the commercials on TV, that pancreatic insufficiency is really big right now, and that goes with insulin resistance as well. Okay. Okay, well, my slide talking about another PCOS study is not, let's see if I can get it to come up, because it's not really being fully visualized here. I'm seeing if I can reboot the slide. Yeah, there we go. So that slide was from a study that showed increased insulin resistance in men with unexplained infertility. So it's interesting how back in 2017, when this study was published, there were other studies saying, you know, just poo-pooing the whole idea and saying that they weren't finding any significant microbiome or hormonal imbalances in men in other studies. And then there were several studies showing increased insulin resistance in men with unexplained infertility. And I think I talked about on the first day also, what insulin resistance is. And insulin resistance is a situation where insulin is not able to bind to the cell because of systemic inflammation, because of hormone imbalance, because of a number of things that can be going on, like sleep apnea or infections or chronic inflammation. And the insulin can't bind, and we need insulin in order to be able to get the sugar or the starch breakdown products inside of the cell to be burned as fuel. And when that doesn't happen, the sugar and the starch go to the liver, and the liver will make it into a fat. That fat gets stored in the liver. That's how we get fatty liver. That's how we get fat in the abdominal wall that we call visceral fat. Both of those fats make their own hormones that will go into the circulation. That's cortisol and estrogen and others that will cause fat to build in other parts of the body. So for today, I have a slide here that's talking about the role of genital tract microbiome in fertility. And what they found in this study was that a lack of lactobacilli in the female genital tract will cause dysbiosis that can result in infertility. Okay, went too far on the slides, but so let's see, we have 5 minutes left, and I wanted to mention too that so yesterday your homework was to look at, do you have labs looking at whether you have insulin resistance? And the first day we talked about what lifestyle factors. I wanted you to look at what lifestyle factors you could work on to improve your fertility. And going back to the graphic that I mentioned, things like nutrition, sleep or stress, detoxification, hormone imbalance, and movement or exercise. So those are areas, and mental, emotional, spiritual is a major area that influences all the other areas surrounding it. And today, you were supposed to look at your labs from the past and see if you saw an A1C, you saw fasting insulin, if you saw glucose, cholesterol, or a blood pressure elevation. Also, one of the labs that I mentioned was the progesterone to estrogen ratio. So there are calculators that you can look online to calculate your progesterone to estrogen ratio. The A1C should be below 5.7. If it's above, or if it's 5.7 or above, you have insulin resistance. You can look at the fasting insulin, and really you want the fasting insulin to be below 7 or 8. And if it's 8 to 10 to 11, then you're kind of in the transition zone. And you can really determine insulin resistance by doing the HOMA insulin resistance score, capital HOMA, all caps, HOMA insulin resistance score. You can look that calculator up online. And if your calculation using the fasting glucose and using the fasting insulin, if the calculation is above 1.9, then you have insulin resistance, 1.9 or above. And there's an Omni calculator that you can use for the progesterone estrogen ratio. Okay, so some some of the things that I just wanted to reiterate were that we talked about microbiome and how important that is, and that dysbiosis can contribute to infertility. And we saw that in a study that lack of lactobacilli in the women's urogenital tract can cause infertility. But that also men can have infertility related to the microbiome in the seminal vesicles and the testicles. and that hormone imbalances, including pituitary tumors, can contribute to infertility, obesity and overweight, because obesity and overweight, the root cause is insulin resistance. So it's no surprise. PCOS, or polycystic ovarian disease, all types of diabetes can contribute to insulin resistance. So in men, some of the things that can contribute are as a result of the insulin resistance, as a result of dysbiosis, as a result of the hormone imbalance, they can have lower sperm count, they can have lower motility, which means the sperm are not as mobile and they can't swim as well. There are increased defects in the DNA of the sperm. When men are older, there's decreased concentration of sperm when men are over 40. And I think I went over everything else. Some of the things that you can do with nutrition are lower carbohydrate nutrition plans. For women with PCOS, we usually recommend like a paleo plan or a low carbohydrate plan. I don't want to say keto plan because depending on the age of the woman, keto may not work that well, especially if they're trying to ovulate. I also talked about a supplement called myo-inositol that women with PCOS can look into, can discuss with their doctor about taking super doses of that. It has been shown in studies to help improve the sensitivity of the ovary to insulin. There are some supplements and antioxidants that will help to decrease chronic and low-grade systemic inflammation. But I would say one of the most important things to do are to improve sleep and to get tested for sleep apnea, because I see a lot of people that have sleep apnea because of the insulin resistance or because of PCOS. Many people are not taking multivitamins, just basic multivitamins with omega-3s. If you're interested in a multivitamin, you can send an inquiry, or better yet, take the quiz on my website, treatyourselftohealth.com. And a pop-up will come up with the quiz, take the quiz, and the quiz will tell you what areas of your lifestyle you can use help or improvement with, and you can converse with me about that. Once you get on that list, you will get the newsletter. And when you get the newsletter this month, I will put a link in there for you to be able to order the supplement that I am talking about. Fish oil or omega-3s are anti-inflammatory. And many people are not eating enough fish to be able to get the amount they need in their nutrition. Prescription probiotics or probiotics that we recommend may also be helpful for the reasons I already mentioned. There's a product called imbalances that you have to have a doctor's prescription to get as well, and I will have links to that. And when I was talking about probiotics, I'm mostly talking about soil-based probiotics. Other probiotics that have random strains, it's hard to know how that's going to help you if you don't know what strains you already have and which ones are in excess and which ones are in deficiency. If you want stool testing, let me know. That's important to get if you're considering, possible treatments for infertility. Also, it's important to get advice on types of folate to be taking. In research, they are showing that you should be supplementing with folate for 2 years prior to getting pregnant. So that is something you want to look into. And there are specific types of folate. Don't just go and buy folate over the counter, because most of the folate you get in the stores is not going to be the correct type of folate. And there are genetic SNPs that can affect what type of folate is best for you. Folinic acid is not a good idea unless that is specifically indicated for your genome type. Okay. All right. So thanks for joining me today. And thanks for joining us in the challenge here. Again, please go to treatyourself2health.com and take the quiz that pops up. And you can also go onto the contact page on my website and ask for a 10-minute free appointment on that page. You can actually schedule it yourself. If you want a longer visit, if you want to bring your labs, and I also have you fill out paperwork, you can do that by getting on the site and scheduling a 30-minute visit. There is a cost involved, but it's the amount of money that if you were going out to dinner in a big city, you'd be spending that amount of money usually. So, all right, take care, have a great evening. Thanks for joining me this week, and I'll see you next month. We'll have another challenge, all right? Bye-bye now.